the prescription was good. It had the diagnosis of the patient and all the details.
Yes.
So the pharmacist packed the medication and labeled with the information of the patient contact address, because the patient sent a rider to go and
Yes.
collect for her the medication.
Okay.
Now, the labeling included the name of the patient, the address, and also the. Now, when the rider delivered the medication to the patient, the patient sued the pharmacist and the pharmacy premise in the context that her private information was actually accessed by the rider, and so the pharmacist was found liable, and the Office of the Data Protection Authority fined the pharmacist 700,000. And although the pharmacist went to High Court, and the payment was suspended until ruling. The ruling has not been done to date. But the PPP also found the pharmacist culpable, and they suspended her license for 6 months.
Okay.
So after actually, because she was called for a hearing, a disciplinary hearing at the PPP, and then that she was not given the penalty for they suspended her license for 6 months. So in regard to labeling, I want to just know, when we are labeling medication, especially for people who have been sent to collect medication, how do we ensure that or to the secondary people? Thank you.
I would want to find out this information that the client was complaining about. Where was it? Because you see, when you have if you are a pharmacy that delivers medication, there's the label that you put on the medicine that should be as per the requirement, as per law. And then I'm assuming you will take these medications and put them in a secondary package. And on the package, you don't have to put medical information. The medical information is supposed to be on the medicine. Then the medicine is supposed to be repackaged with just the information and address of the patient without the medical information. So now my question is, what was the pharmacist being sued for? Did she put medical information on the outside package?
Yeah, because since the prescription had the diagnosis, she actually put the same information on the details of the patient, including the diagnosis, on the pack that she gave to the rider. So the issue was that she was exposing the patient, sued her because she was exposing her diagnosis to other people who are not supposed to know her condition.
That makes sense when you think about it, even because you see, as you're doing this, you're operating in your professional as well as I'm assuming you also have social intelligence. You have professional intelligence, which tells you, when my patient gets this pack of medicines, I want them to get all the information, and I'm going to include all the information on the label. Remember, when we were talking about labeling, we did not say anywhere that it's a must, that it's a legal requirement, you include the diagnosis on the label. Okay, the diagnosis and all that other medical information is on the prescription. And I'm assuming the prescription came to you confidentially. Okay, probably it came in an envelope to this pharmacist. Now, professional intelligence, I'm expecting that as per requirement, she was to look at the prescription, write the label for the medicines, put them in a secondary package. On that secondary package, all you need to indicate, which is sealed, okay? because remember we've been saying that pharmacy is moving. We have this, what were we calling them? Deliveries. We talked about them in our earlier class, where a patient, sometimes the doctor can even send you the prescription online and you package the medicine. And we said, make sure the label has all the information that the patient needs. So you package everything with the information that the patient needs, ensuring they'll be able to take their medicine, but you don't need to put that information on the secondary package that you're going to give the rider. The rider, the only information the rider needs to know is the name of the patient and the destination. They don't need to know the age. They don't need to know anything else. Okay. So when you think about it, this pharmacist was liable. They actually failed the patient by putting all that medical information. Why do you take medical information and put it on a package for the rider? The rider is not the patient. He's not the patient's doctor. He has nothing on this to do with this information. All they need is the name of the patient and the address. So when you think about it, this pharmacist was actually liable.
Yeah, thank you.
Okay.
I get it clear.
Okay, so that is a good question, and it's important for all of you to understand. As much as you're working in your professional capacity, also use your social intelligence, okay? Make sure that if I'm giving somebody information, what are they going to do with this information? Is it important for them to know this information, okay? So, for instance, I'm your lecturer, okay? I teach you in class. I grade your papers. Now, if I meet whoever, your friend on the road, the information I'm going to give them about you, how is it going to help you and how is it going to help them? Okay? Do they have any concern with this information? I hope you get my point, okay? Always when you're working in your professional capacity, ask yourself, if it is a doctor who is asking for a patient information, that is different, okay? This pharmacist, if they were sending this to a patient, and of course, even if they were sending this information to a doctor via a carrier, that information should be sealed, and the carrier only needs to know the address and the name of the doctor. They don't need to know anything else in that package, okay? So always keep in mind. Remember we said, when we started this class, we said, you are coming into practice at a time when the general population is very aware of their rights. So even as you get into practice, you need to make sure that you're practicing within the law. Be professionally intelligent, but also be socially intelligent. Okay, I hope that is clear. Thank you for those questions. Any other before we get on with packaging? Okay, so last week we were looking at packaging, and thank you for making this class happen, even though I can see we won't, we probably have an hour, but I requested for this class so that we don't have to have our Wednesday class, okay? So we will do this class and then we will come and finish up next year, okay? So we said packaging, remember when we introduced packaging last week, we said that packaging is any material that is used to actually contain the pharmaceutical product. And just to recap, we said packaging includes the bottle or the container that is holding the medicine. It also includes the closure. Okay, you can see here we have the caps. It includes that because sometimes if you look at this bottle, if this liquid in here, it is going to actually come into contact with the glass. It is going to come into contact with this rubber, okay? So because of that, when you're thinking of packaging, you have to think of packaging in totality to include both the glass and the cup. Even here, you can see this bottle. It's in contact. The medicine is contact with the bottle and with the cup. The reason for this, and next semester we'll be looking at drug development. During drug development, sometimes you get a scenario whereby the medicine contained in this bottle reacts either with the bottle or rather has potential to react with the bottle and with the cup, okay? So that's why when you're choosing a container, you have to ensure that the container is actually compatible with the container plus the cup, okay? What we usually refer to as the container closure system, okay? So container closure system, this is the packaging. Now, this is referred to as primary packaging. Then we have secondary packaging, which is not in direct contact with the drug, okay? So we have this box, and also this medicine leaflet is also considered as the part of packaging, okay? So that was our introduction last week, okay? We'll continue on with packaging. So the packaging should be chosen such that it does not have adverse effect on the product, for instance, through chemical reaction, leaching of packaging material, or absorption. So you do not want your drug to react with the package, okay? Neither do you want the bottle to release any material into your medicine, okay? This is what we are referring to as leaching, whereby when the liquid comes into contact with the glass releases some material into the liquid, okay? So that we want to avoid that. The product, and sometimes also you have scenarios whereby when the liquid comes into contact with the glass absorbs. There are some substances in the medicine that get absorbed on the glass, okay? So for instance, there have been scenarios where, because this is a liquid, you add a preservative to it to prevent growth of microorganisms. But when you put it in a container, the preservative, instead of remaining in the liquid, it attaches onto the glass, okay? And now, because it is not in the medicine, you actually get microorganisms growing in that drug simply because the preservative that was in that liquid, instead of remaining in the liquid, it attached itself onto the glass, okay? So it's important for you to appreciate that. And usually when you're picking this packaging, you have to do tests to ensure that the preservative you're using does not actually end up on the bottle, okay? Because then otherwise you end up with a product that is growing microorganisms, okay? The product does not have any adverse effect on the packaging, okay? Changing its properties or affecting its protective function. Because again, remember, if the medicine reacts with the package, okay, you may actually end up with a scenario whereby the package actually collapses. Because remember, these two are substances, okay? You have this, if there is a reaction, okay, you have the bottle, then you have the medicine, okay? In case of a reaction, you get a product, okay? Such that, remember, the function of the package is to contain and protect the medicine. If there's a reaction between the package and the medicine, you may actually end up destroying the package, okay? And then now, after that, this package is no longer able to protect the medicine, okay? So these requirements must be met throughout the whole intended shelf life of the product. You want to be able to prove that for the full shelf life, if your product is going to be in the market for 2 years, you want to make sure that this package will remain, okay, viable for the whole 2 years. At no point will you have the package deteriorating, okay? Interaction between packaging and products occurs due to to a combination or a multiplicity of factors. Therefore, the packaging chosen must be of good quality to withstand these factors, okay? It should be able to withstand the container components. It should be able to withstand the active pharmaceutical ingredient, the excipients, plus the solvents used. You may get a scenario whereby the package, because of the solvent that has been used, it actually deteriorates, okay, or degrades. The solvent degrades the package, okay? So that's what we are talking about. That you need, and during drug development, in our class next semester, we'll look at this. During development, you have to look at the container, test it with the active ingredient. Are they compatible? Then test the container with the excipients. Are they compatible? Then test the container with the solvent, okay? And remember, we said the container means the container plus the closure system, okay? So what are the factors to be considered when choosing a packaging for a pharmaceutical product, okay? The package chosen must contribute to the delivery of the drug to a specific site of activity. To ensure adequate delivery, the following factors must be considered. So when we talk about delivery, remember last week we talked about the inhaler, and we said, depending on the kind of drug that you have, the delivery system is very important. If it is just a tablet, then that is not an issue. Tablets usually can just be put in a bottle, the patient takes it and swallows it, okay? But if you have something like an inhaler, you need a packaging that will be able to break this, suspension into droplets so that they can be absorbed, okay, and taken in by inhalation. Because imagine if I gave you a bottle, okay, of liquid and told you this is to be inhaled, what would you do with it? Okay, I have the drug formulated very well, okay, and I need to give you 30 ml of this, and I tell you, you need to inhale this every morning for the next 1 month, okay? And the drug is not volatile. How are you going to do it? So that is what you need to think about. This inhaler is able to break down, okay, this inhaler into an aerosol, okay? An aerosol which now as the patient you're able to inhale, okay? So that's what we are saying here. When you're talking about packaging, sometimes the package will serve more than just containing, okay? It will not only contain the product, it will also serve the purpose of delivery, okay? So it's important for you to appreciate that. And last week we mentioned that sometimes you may find that the cost of the package is much higher than the drug itself. Like if you look at the inhaler, the cost of that inhalation, the drug inside, is very little compared to the inhaler system, that bottle, okay? Because that inhaler system has been made specifically to be able to generate an aerosol that can be inhaled into the lungs. Without that system, your drug is actually useless to you, okay? So that's what we are talking about, okay? So these are the things that must be considered. The nature of the product, okay? Here we are referring to its chemical activity, its chemical characteristics, okay? Its activity, sensitivity to moisture and oxygen, compatibility with packaging material. Then we need to consider the type of patient. Here, we need to find out, is it going to be used by an elderly patient? This elderly patient, do they have arthritis? What do you know about arthritis, Bruce? Do you know anything about arthritis?
It is an inflammatory condition of the joints, especially.
Yes, it's an inflammatory condition of the joints. And usually what you will find is that some of these patients with arthritis, the condition is so severe, okay, that they may not even be able to handle things, okay? So I just a minute, I want to show you a picture of a patient with arthritis, okay? What arthritis sometimes can do to the hands, okay? So usually with these patients, because of the inflammation, there is inflammation in the fingers, okay? So if you give them a package that they are not able to open, okay, excuse me a bit. Okay, sorry about that. So I want to share my screen. Okay, Bruce, can you see the change on the screen?
No.
Can you see anything on the screen?
No, I can only see factors to consider. The slide.
Okay. Let me share it again and see whether it changes. Okay, and now?
Not yet.
Okay. Or maybe your internet is slow. Does anyone else see a hand on the screen?
No.
Okay.
The screen is the same.
It's the same.
Yes, it is factors to consider in choosing a packaging pharmaceutical products.
Okay, I don't know why it's not sharing. Okay, tell me if you can see it now.
It's why it's visible now.
You can see the hand.
Yes.
Okay. So this is what we are talking about. When you're talking about a patient who has arthritis, sometimes the arthritis is so severe, as we were told, arthritis involves inflammation of the joints, okay? And sometimes this inflammation can be concentrated or it can be severe for this patient such that you can see the digits, okay? They are swollen. And sometimes you actually have patients with severely, you see like this one, all the joints in the digits are actually swollen and they become deformed, okay? So this is what we are talking about, okay? This is what we are talking about, okay? Depending on the type of patient that you're talking about, if this drug is actually being formulated for an elderly patient, okay, who has arthritis, you need to formulate it and package it in a package that the patient will be able to access. Because think about this patient. If you give them a medicine bottle that is complicated to open, okay, this patient may not be able to access the drug simply because the packaging is actually hard to open, okay? This is what we are talking about, okay? Then the dosage form, if you're formulating a liquid or a solid or a semi-solid, again, think of the kind of package you will use, okay? If you take a liquid and put it in a wide-mouthed bottle, okay, you may get a scenario whereby when the patient opens, all of it actually gets poured out, okay? Or if you get a semi-solid, okay, and you put it in a wide-mouthed bottle, or you get it and put it in a tube, which one is more convenient, okay? Then think about the method of administering the medication. Is it going to be instilled, meaning you want the medicine to be able to give you a drop, okay? If you put it in a bottle that is wide-mouthed, okay, can you able to get drops, okay? Of course not. You will need to actually have a fluted bottle that when you actually, instill the medicine, it comes out as drops, okay? Then the required shelf life. Again, when you're picking your packaging, this package, if your drug is going to stay on the shelf for 5 years, are we assured that the package can also last for 5 years, okay? Then think of the intended use of the product. We've already talked about this has more indication on, is it going to be given parenterally, okay? And because of that, if you're giving something parenterally, Mercy, Drusilla, if I'm telling you that this drug is to be given parenterally, okay, what do you think you should think about as a formulator? What would be?
It can be in liquid form.
Okay, it can be in liquid form. Yes, but what is important with regards to, since it is going to be injected, okay, what do you need to consider for the safety of the patient? Yes, Mercy, kindly unmute.
Maybe it can cause a reaction when it's being administered, either by emulsion.
Okay. You could actually have the patient react, okay, because of if the drug is not sterile, okay? So for all injectables, they must be sterile, okay? So when you're picking a package, you need to pick a package that will actually ensure sterility of your product, okay? So I hope you're able to think through all these factors to ensure that by the time your product has been formulated, You considered all this so that you produce a product that will be acceptable for so these factors to be considered when you're choosing this product, okay? There are different aspects of the packaging that you need to think about. Think about the functions of the package. Is the package just meant to contain the product, or is it meant to protect the product? When you think about the drug, is your drug sensitive to light? If it is sensitive to light, what that means is that the package should actually protect the product, okay? Or if your product is meant to be inhaled, then what is the function of that product? It is actually meant to facilitate administration, okay? Or if it is meant to be instilled as drops, the package should be able to generate the drops, okay? So that is what we are talking about. Then selection of available options of a packaging material. Remember, there is the ideal package, okay? But there are the materials that are available, okay? So when you're picking the package, you need to look at the available options, okay? And then based on the available options, you carry out the compatibility tests. And after carrying out the compatibility tests, you now decide on which package will be the most favorable, okay? Then here you carry out testing for the material that has been selected. You test the products together with the material or the packaging material to ensure that they are compatible, okay? Again, you need to think about the filling and assembling that is required. If you've picked, if you decided to package your material, if you decided that your drug is going to be injected and it needs to be sterile, you need to think about that process of filling, okay? If you're going to fill it in vials or you're going to fill it in ampoules, okay? Do you know the difference between a vial and an ampoule, Faith?
I think ampoule comes in like a small capsule, like it's like a metered dose, something like that, and then a vial is a liquid one.
Okay. Let me just show you a picture. So can you see the picture, Faith? Can you see the
Yes.
picture? Okay, yes. So these are ampoules, okay? And these are vials.
Yes.
Ampoules usually, it's the same, ampoules can be glass or they can be plastic, okay? And you can see this is the same material. If it's glass, it's one actually piece of material. When you need to use this ampoule, you have to break it at the neck, okay? Because it's actually one container, okay? It does not have a closure cap, okay? That is different. If you look at the vials, you can see there is a bottle and then there is a cap. With the ampoule is actually made of one material, and when you're ready to use it, you actually break this neck, you insert your needle and withdraw what you need to use. Whatever remains, you discard, because by the time you break this, you'll not be able to close Okay, and remember this product is sterile. Once you open it, you cannot store it. With vials, they have several doses in it. Okay, so you can go in, inject your needle there, withdraw what you need, and you can keep this to be used next time. With these ampules, once you break it, you withdraw what you need. Any that is remaining, you discard. Okay, so it's important for you to appreciate that when you're picking your material, you need to ask yourself, how will this be filled and assembled? If you're in an industry and you're deciding to actually produce ampules, then you need to ask yourself, do I have a machine that will be able to blow out that bottle into an ampule shape, fill, and then seal it? Because that is what usually happened. You blow up the ampule at the point of production, it is filled and sealed immediately. Okay, so again, that is what you need to think about. Then with regards to sterilization, does your drug require to be sterilized? If it is a drug to be injected, okay, then you need to ask yourself, the package that I'm picking, can it withstand sterilization? Which method am I going to use for sterilization? Am I going to use heat? Am I going to use gas? Okay, and if I'm going to use heat, will this glass be able to withstand sterilization? And we'll be looking at that next semester in the drug development class, okay? Then look at storage requirements and stability. Remember, we talked about drugs like insulin. We said insulin is proteinous in nature, and because of that, it needs to be stored in the fridge. Now, when you're picking a packaging material for insulin, can that packaging withstand storage temperatures? Those are things that you need to actually think about, okay? So I hope that is clear. So packaging should be able to do all the following. Number one, protect against all adverse external influences that can alter properties of the product. So for instance, if your product is sensitive to moisture, light, oxygen, and temperature variations, the packaging should be able to protect your product from all this. It should be able to protect against biological contamination. Here, we don't want your product to get contaminated with bacteria or any other microorganism, okay? So ensure that it is protected, protect against physical damage, okay? And then carry the correct information and identification of the product. Remember we said you have the primary package, okay, which is in contact with the product. Then you have the secondary packaging. The secondary packaging generally carries the information about the product. Remember, I showed you the box plus the patient information leaflet, which forms the secondary packaging. Then functions of packaging. Packaging will serve different functions, okay? Starting with, this is the most fundamental function of packaging. The package will actually serve to hold the product, okay? What we are referring to as, containment, okay? The design of high quality packaging must take into account both the needs of the product and of the manufacturing and distribution system, plus administration, and we've already talked about that. Therefore, the package must not leak or allow diffusion and permeation of the product. It should be strong enough to hold the contents when subjected to normal handling. It should not be altered by the ingredients of the formulation in its final dosage form. Then, protection is the second function of packaging. The package must protect the product against all adverse external influences that may affect its quality or potency, such as light, moisture, oxygen, biological contamination, and mechanical damage. Then we have presentation. Again, remember we've talked about the secondary package, okay? Packaging is an essential source of information on medicinal products. Such information is provided by labels and package inserts for patients, Okay, as we've said, it's important that every medicine must have a label. Okay, we've been talking about the label that the patient goes home with, and we said as much as the manufacturer has given the medicine a package, okay, that package, when it is leaving the pharmacy on a named patient basis, that package should have a label specific for that patient. Okay. Then the fourth function is compliance. Packaging is a compliance aid, and the packaging and labeling may help to reinforce the instructions given by the physician or the pharmacist, and therefore improve compliance with the drug therapy. The packaging should be designed such that the product can easily be administered in a safe manner to the patient. If the patient feels at ease with the packaging and route of administration, compliance is enhanced. Then protection of patients. Packaging protects the patients and indicates the integrity of the product. Remember, we said every medicine label should contain the statement, keep out of reach of children, okay? So this is one aspect of protection for the patients, okay? Here you have protection for children, okay? So that children are not able to access medicine. And we'll be looking at some of the packages that have been designed in such a way that you prevent access by children, okay? Then the other aspect of protection is tamper evidence, whereby the package has a device that is able to show the patient that this drug has been tampered with. For instance, if you look at when you buy water, okay? Francis, when you go and buy a bottle of water, how do you know that this bottle is safe to drink? How do you know that your shopkeeper has not interfered with it?
First, I check the seal on the cup to make sure that the seal is not broken. And then there is that packaging, like the packaging paper. I make sure that it's intact so that I'm sure that no one has interfered with it.
Yes. What Francis has just described is tamper evidence, okay? You are sure that the water I'm taking is still the way the manufacturer released it to the shopkeeper, okay? If you find that seal has been broken, it tells you that whoever was handling this bottle has interfered with it, okay? That is one way of protecting the consumer. When you get it and the seal is intact, you are assured that this product has not been tampered with en route to the end user. This is the same thing that happens with packaging for medicines, okay? Packaging equipped with tamper evident device protects against incidental and accidental poisoning, okay? You don't want a scenario whereby you're taking medicine and this medicine has been tampered with. Maybe the tablets have been changed, okay? So to avoid that, before you start taking, you make sure that this is actually the seal that was placed by the manufacturer, okay? Then number 6, detection of counterfeiting. The design of the packaging should contribute to preventing tampering with or the counterfeiting of certain medicinal products. There are some manufacturers that can actually design packaging, okay, such that a counterfeiter will not be able to counterfeit that product, okay? And some manufacturers will keep changing the packaging, okay, because of this issue of counterfeits, okay? Such that when you look at the package, you can actually tell this is, you know, a seal specifically for the manufacturer. I'm sure you've seen in the supermarket sometimes back, there was this baby formula, okay, the baby milk. And it came with a metal seal. On top, a metal wire that was used as an additional seal on that baby formula. I don't know whether you've seen that. You can walk into the supermarket and see, I don't know whether it's still there, but you will see that there's an additional seal, okay? Such that you can tell, first, it is tamper evident that if that seal is broken, don't use it. But again, it is assumed that this is a special, wire or device, such that probably they get it from a specific area, and the counterfeiter, patients can actually know if this milk does not have this wire, then it means that the milk is actually not from the original supplier. I don't know whether you've seen that. If you haven't, kindly pass by a supermarket and check. You'll be able to see that, okay? I hope they are still using it. So the design of the packaging should contribute to preventing tampering with or the counterfeiting of certain medicinal products. Tamper-evident containers can allow the visual inspection of the medicinal product before use for authentication. Specially designed containers may serve as a first stage in detecting counterfeit drugs. So let's look at the types of packaging. There are two types of packaging, primary and secondary packaging, okay? Some people may name up to tertiary, but for this class, we are mainly concerned with the two. The primary packaging, which is in direct contact with the product, okay? Like if you have a bottle, the bottle containing the liquid, that is the primary packaging. And the primary packaging consists of the bottle plus the closure of that bottle, okay? Then we have the secondary packaging, okay? Which is now the box, okay? Anything that is not in contact, in direct contact with the drug, that is secondary packaging. You may also have tertiary packaging. You see this, the big box, okay? You have the big box in which you put the smaller boxes which contain the drug, okay? I hope we understand that, okay? So let me see if I can show you a picture. Okay, so again, I will share my screen and okay, can you see the screen?
Yes.
Okay, so I hope you can see there's a box. You have these are blister packs, okay? You can see there are capsules. The capsules are in contact with these blisters, okay? Now this blister pack, that is the primary packaging for the capsule, okay? Behind it, you can see there's a box where you put this blister, okay? Several blister packs, you put them in this box. That is the secondary packaging, okay? And then these boxes, several of them are put in this carton box. This would be what we would be referring to as the tertiary packaging, okay? Again, with the bottle, okay? You can see that inside this, okay, we have this tertiary package, okay, the carton box. Then inside, we have put boxes, okay, small boxes containing bottles, okay? So this is the tertiary package. Then these boxes are the secondary package. Inside those boxes, we have bottles. Those bottles are the primary package, okay? So that is what we are referring to, okay? So for the purposes of this class, we are mainly concerned with the primary and the secondary package, okay? And the primary package is in direct physical contact with the product. This include bottles, vials, closures, blisters, anything in contact with the drug itself. That's the primary package. Secondary package are not in contact with the product, okay? Such as aluminum cups, cardboard boxes, okay? Plus the leaflet, okay? The choice of the primary or secondary packaging material will depend on the degree of protection required. So if your product requires to be protected from light, that bottle will need to be amber colored, okay? Or again, compatibility with the contents, okay? You need to carry out tests to see whether there is compatibility, okay? Then the filling method and cost, okay? What is the cost of the package, okay? Then presentation for over-the-counter drugs. You will find that drugs that are sold over the counter, usually manufacturers will go out of their way to make them appealing, okay? Of course, they are not supposed to go overboard, okay? But it's a requirement that they are not supposed to be overly attractive. That's a requirement by law because drugs are not supposed to be used. The patient is not supposed to come in and pick the drug as though they are picking clothes on the shelf, okay? But over-the-counter drugs, generally, the manufacturer tends to make them more aesthetically appealing, okay? Then convenience of the packaging for the user. For example, think of the size, the weight, method of opening and reclosing, if appropriate, and then legibility of printing, okay? So let's look at types of primary packaging containers, okay? It's important that you are actually able to appreciate this, okay? So we have the single dose container. This is a container that holds a quantity of the preparation intended for total or partial use as a single administration. Remember, we talked about the ampule, okay? This ampule, once you break it, okay, there's no way of resealing it. This product in here is actually sterile. So once you break this ampule, you're expected to withdraw all the drug in there and use it. If you need less than what is in there, any that is remaining, you discard, because the sterility of that product can no longer be assured because you will not be able to seal this product, okay? We have these glass ampules, then we have these plastic ampules, okay? They are both the same. Once you break it, you use everything or you discard whatever is remaining. That's an example of a single dose container. Okay, excuse me. Let me take care of some noise. Just a minute, Wesley. Let me get. Yes, Wesley, you had a question? Okay, I can't hear you. Yes.
For the glass ampules,
Yes.
do some of the glass particles enter the ampule once you break it? How sure are we that it's going to be completely sterile once you break that glass material?
Yes, your concern is real. If you go online, you can just go online and check. I think this was a concern that was raised if I remember some time back, and I think there is even a paper online about glass particles in ampules. Medication. I think it was a concern, I think, yes. You can read about this online. There's a paper on safety concerns with glass particle contamination. So it is a valid concern. So even as you break it, and I think it's actually, it's, what is it called? It's a paper that was written, okay, on the safety of the contents of ampules after you break it, okay? So it's actually a concern that has been raised, okay, that it's possible that when you break it, you could end up with glass particles, okay? So because of that, if you have that concern, then you can opt for the plastic ones, okay? But again, remember, sometimes you may not use the plastic one because probably the kind of drug that you have is reacting with maybe the... So again, these are the challenges that usually you may experience as a formulator when you're choosing to actually, when you're choosing which container or which material to use for your container, okay? Yes. Does that answer your question?
Excuse me?
Yes.
Yes, I just want to say that for the colleague who's concerned, when you look at those ambules, they have a line. At the neck, there's a line. That line is a line of weakness. So when you are breaking that ambule, that's where it breaks. Again, in hospitals or injecting rooms, they have gadgets that helps you to break that ambule at the right place. These are mechanisms that are put in place to ensure that the bottle does not brittle. Because when it brittles up, that's when you may end up with maybe particles into the into the ampule. Then you can maybe inject someone. And again, if the ampule does not break well, then you don't need to remove the medication. And then even after you have done you have already cut the ampule, you also do physical check in the medication to ensure that nothing has actually dropped inside. And then also when you look at the lumen of the needle, it's too small that sometimes glass particles they may not go inside. So those are some safety measures that have been put in place, and also for those who administer, they can check to ensure that you really don't administer glass particles into someone. Thank you.
Okay. Yes, thank you for that, Julius. That's true. If you when you break a glass, okay, if you take a glass and you smash it, you get particles, okay. But what Julius is describing, that maybe we can just go back to that picture. If you look at this ampule, okay, there's a line there. It's been indicated where you actually break it, okay? Because of that line of weakness, it prevents that splintering of glass, okay? So that you don't end up with these particles, okay? So because of the concerns that were raised, these manufacturers of ampules are supposed to do it in a way to ensure that you actually do not get such scenarios, okay? But you can go ahead and look at the articles, okay, because the concern is valid. It has actually been investigated. And one of the things that they found, because what this, the test that they were doing was breaking the ampules. They would break the ampule and then use a fine, very fine mesh to check, okay, for the whether there would be splinters, okay? So you can look at some of the papers online because some of these concerns have been raised and people have actually, there's research that has been done, okay? Like if you look at, there are several papers, okay, that are online with regards to glass microparticulate contamination of intravenous glass, okay? So the microparticulate, these are things that you may not be able to see with your naked eye, okay? Which could be, because you see with the splintering of the glass, that is something you can see, what Julius is talking about, such that if you can see the splinters, then you avoid using that, okay? But the micro particulate, you probably may not be able to see that, and that has been a concern that has been raised, okay? So there are papers online, you can look at them. There's, I think one of the recent ones, there's one by Oxford that is from 2015. There is one 2021 actually, okay, by Chiani Kulchai. So you can look at them and, you know, this will be mostly in preparation for our class next semester, as we'll be looking at, you know, drug development. Those are some of the things that you're looking at, okay? But yes, that was a good discussion point. It is a matter of concern, and it's good that you actually think through these things, because that is how now you think of how else do we limit that. Because like the splintering that Julius is talking about, that was dealt with by using that line of weakness, okay? But like the paper that was done by Oxford, if you look at it, it talks about micro particles, okay? Now, glass microparticles, you may not be able to see them with your naked eye, okay? So this is still a concern. So if you have a concern for that, then usually if your drug can actually be contained in a plastic ampule, then that can be used, okay? Does that answer your question, Wesley?
Yes, yes, it does.
Okay. Yes,
Thank you.
Simi. Simi, your hand is up.
Yes, won't a plastic ampule give us the same issue? Because actually we're living in a time where we're facing a major crisis when it comes to microplastics in almost everything, from food to pharmaceuticals, sorry.
Yes, it will actually give you the same issue. I don't know whether you watched, there was an activist who was had gone to court to contest the issue with plastics. And she was wearing spectacles because she was saying we want to do away with all plastics. We don't want plastic in for food. We don't want plastic to contain drugs or cosmetics. Then the judge asked her, what material will we use for spectacles? Because she was actually wearing spectacles, so you could see that she actually needed them. Because you see, there are people who will only need spectacles for reading, but for her, she actually needed them for daily use. Okay, so all these concerns are there. Okay, we may decide to do away with glass, and but plastic has issues. We may decide to do away with plastic, but which other material is there that we can use for? There are things that there is no alternative. Okay, so we can't go on and demonize everything. Okay, we have to ask ourselves, if we decide that this material is not useful for pharmaceuticals, then we need to ask ourselves, what alternative is there? Because until we get an alternative, then we will probably have to make do with whatever is there. Currently, sometimes what they do is when we'll be looking at drug development, we will also look at packaging. Sometimes you actually can coat the package, okay? You have, like if you look at these packages that are used for tubes, medicines that are placed in tubes, you can find the tube has been coated, okay? Coated inside so that the medicine does not come into contact with, the metal, okay? Because probably the medicine reacts with the metal. So those are some of the things that are upcoming, okay? Whereby you can actually use a coating to reduce the reaction. But for now, until we actually have an alternative, because you see, we cannot say we will not supply an anti-asthma drug, because the drug, the microplastic will end up there. Because then either we are losing this patient now, okay, because they have an asthma reaction, we give them the drug now, or we decide, okay, for that matter, we will not package medicines until the day someone will discover another package. Okay, you get the dilemma there. Does that answer your question?
Yes, I get the dilemma. But I think so long as there's never been a case of anyone dying from receiving a drug from an ampule, then I think that's okay.
Okay.
Because they've
Yes.
been there
So
since the 1840s.
yes. So and that's why these research papers are there. That's why I was telling you, go and look at that research paper on micro glass particles. Okay, because the research is there to allow people to think, what else can we use for packaging? Okay. And especially with the drugs, you now have to carry out tests to see this alternative that we are deciding to use. Because sometimes you actually decide to pick an alternative and it ends up being even worse than what you previously had. Okay, so that's why research is there. You look at whatever is there, you test it and check whether alternatives can be had. Okay, so that's the single dose container. We have the multi-dose container, which holds a quantity of the preparation suitable for 2 or more doses for multiple administration. Okay, so for instance, your multi-dose container could be like ampules, or rather vials. Okay, you can see this vial has, it's a full bottle. Probably it has 10 doses. So every time you need to take a dose, you open the cap, you inject your needle, withdraw what you want, okay? Keep the bottle on the shelf, come back again, withdraw. So this will contain 7, okay? That's a multi-dose container, okay? Then, again, this is a vial. This is a bottle for oral consumption, okay? This bottle, usually you will tell the patient, say, take 5 ml, once a day, okay? So this bottle will contain maybe 100 ml. This is now a multi-dose container, okay? It contains several doses. You come in, you pick, you administer. Again, next time you come in, you pick, you administer. These are all multi-dose containers, okay? Then we have the well-closed container. This is a container that a well-closed container protects the contents from contamination with extraneous solids and liquids and from loss of contents under ordinary conditions of handling, storage, and transport. Then we have an airtight container. This is impermeable to solids, liquids, and gases under ordinary conditions of handling, storage, and transport. If the container is intended to be opened on more than one occasion, it must be designed such that it remains airtight after reclosure. Then we have the sealed container. This is a container closed by fusion of the material of the container. So an example of the sealed container is this ampule, okay? You can see it is actually made of the same material. The bottle plus the cap are the same material and it is sealed. Even this, it's the same material and it is actually sealed, okay? So it is a container closed by fusion of the material of the container, okay? And usually they are used for sterile single dose products, because once you open it, once you break the seal, you either use everything that is in that container or any amount that is remaining, you discard, okay? Then we have tamper-proof container. This is a container, a tamper-proof container is a closed container fitted with a device that reveals irreversibly whether the container has been opened. You remember like the case we were talking about where the bottle has been sealed, okay? That is your tamper-proof container. You can see there's a seal here. Look at these bottles. There's a seal here, okay? If you twist that cap, the seal breaks. Once it has broken, every other person should be able to see that that container has been, the seal has been broken and they should not use it. These are examples of sealed containers, okay? This middle one, when you, usually the manufacturer will add the medicine, then put the seal on it, okay? Anyone who turns this cap to open it, this seal breaks and you can see, okay? So this is a sealed container. For food products and cosmetics, they will come with such a seal. You can see if you buy things like something like Blue Band, something like peanut butter, usually it will have a seal like that, so that you use it when the seal is, you actually have to break the seal for you to use it, okay? Those are examples of sealed containers, or rather tamper-proof containers. They have a seal or a device such that once it's broken, it is irreversible and everyone can see that the seal has been broken, okay? Then we have the child-proof container. This is a container that is fitted with a closure that prevents opening by children, okay? So your child-proof container is like this one, okay? Hopefully you have seen containers where you are told to press down and turn, okay? It's assumed that the child will not be able to carry out such mechanisms of, you know, like that container, if you don't press down as you turn, it will not open. If you just turn it, it doesn't open, okay? So like this one here, push down and turn. If you keep turning, it just keeps turning. Until you press down and turn, that's when you will be able to actually open it. This is an example of a child-proof container, okay? So like this one, while pushing down, turn, okay? And it tells you the direction to turn, okay? This is a child-proof container. It is assumed that only adults will be able to coordinate these instructions and open it. A child who has not reached the age of understanding should not be able to access that medicine, okay? Then other containers, we have light-resistant containers. This will protect the contents from the effects of radiation at wavelengths between 290 and 450. Basically, you're protecting them from light, okay? Then we have strip packs. These have at least one sealed pocket of material with each pocket containing a single dose of the product. The pack is made of 2 layers of film laminate material. The level of protection required by the contained product determines the composition of the layers, okay? So, okay, these are amber colored bottles. They're light resistant, but what I wanted to show you was this. These are strip packs, okay? If you've ever bought a drug like, say, Maramoja, okay? usually that pliable material, okay? It's not a blister pack. It's basically aluminum foil that is pliable, and it's sealed on top of that, okay? That is the strip pack, okay? Then we have blister pack. These are made up of a base layer with cavities that contain the pharmaceutical product and lid. The lid is sealed to the base layer by heat, pressure, or both. They are mainly used for tablets and capsules. They can be printed with day and week identifiers to produce calendar packs to support patient compliance. So blister packs, this is what they look like, okay? You can see there is a plastic, okay, pocket, and then on top of the plastic pocket, you have an aluminum foil to seal it. You can use it for capsules. You can also use it for tablets, okay? That is what we refer to as blister packs. And sometimes what we are saying is that, and we'll be looking at that kind of packaging, it's called compliance. You can have a blister pack where it's written the days of the week, say Monday, Tuesday, Wednesday, Thursday, Friday, Saturday, Sunday, so that if it is, say, something like contraceptive pills, the patient can clearly follow, okay? They know when to start, so that in case they miss a dose, they can actually tell that today is Tuesday and I can see I did not take the one for Monday, okay? So that helps with compliance, okay? So usually the compliance, and we'll be looking at that later, but the compliance, usually you use blister packs, but you date them to assist the patient to comply, okay? Then we have the pressurized packs. These will expel the product through a valve. The pressure for expulsion is provided by the positive pressure of propellant, which is usually compressed by liquefied gas. So again, with the pressurized pack, these generally are the ones we've been talking about. You see, like the ones used for inhalers, okay? You have a liquid in here that is under pressure, okay? So you basically, usually you have to demonstrate to the patient how to be able to administer this drug. But there's the drug here under pressure. You basically press it and you're able to administer the drug to the patient, okay? That is an example of a pressurized pack. Then we have the original packs. These are pharmaceutical packs commercially produced and intended for finite treatment periods. These packs are dispensed directly to the patient in the original form. Manufacturer's information is usually contained on the pack, but the pharmacist must attach a dispensing label. So again, this is an original patient pack, okay? You can see this drug came from the manufacturer in this pack, okay? It has come with the manufacturer's information and all that. But as we said in the dispensing class, as much as this drug, this pack contains all the drugs the patient will need for the month, you can see this is 28 tablets. If the patient is taking one a day, these are enough for 4 weeks, okay? So it's a patient original pack, okay? You basically have to append a label here specifying to the patient how they are supposed to take the drug. That is an original patient pack. Then we have the tropicalized pack, okay? Tropicalized packs, these are blister packs with additional aluminum membrane to provide greater protection against high humidity. For example, on the market, you will find Augmentin and Ampiclox. Excuse me. So you can see inside the tropicalized pack, you have a blister. You can see these are blisters, okay? Excuse me, these are blister. Then on top of the blister, you add aluminum foil, okay? And this is usually, especially so for medicines that are sensitive to light, okay? If you have a medicine that is sensitive to light, usually what will happen is you will package them in aluminium, and then add a foil on top. Okay, so you can see with this one, inside this, you can see this is sealed with foil. Okay, but inside this, you have an blister pack. Okay, so when you take a blister pack and on top of it, you place this aluminum foil and seal it, okay, what happens is you are protecting this product from moisture. Okay, so that one is called a tropicalized packs. They are blister packs with additional aluminum membrane to provide greater protection against high humidity. Okay, so those are tropicalized packs. So what are the requirements for packaging material? All packaging must meet the following requirements. 1, it must preserve the physical properties of all dosage forms and protect them against damage or breakage. Second, it must not alter the identity of the product. So for instance, when we're talking about injectable product, when you formulate an injectable product, you specify the pH, you specify the osmolarity, you specify all these things, okay? You do not want a scenario whereby when you place it in contact with glass, for example, it has been found that glass, okay, with some material, it actually sheds to release alkali into the product, okay? Such that if you had a product that was at a certain pH, if you place it in glass, some products will actually become more alkaline, okay? So that is what we are saying. It must not alter the identity of the product, because if it alters that pH, you may find that there are some APIs that will start degrading. Maybe you placed it in acidic pH because in acidic pH, it's stable. But now you place it in glass, the glass starts shedding into the product, the pH turns alkaline, and your drug deteriorates. Okay, so that's what we are saying. It must not alter identity of the product. Okay, if that is happening with your product, choose another material. For example, use plastic. That's why we are saying when you're choosing packaging, tests have to be carried out, okay, especially during drug development, okay? Because in the pharmacy, usually you can tell. As we said, when you see a drug that has been packaged in amber-colored bottle, of course, that tells you this drug probably is sensitive to light. So if I'm going to change the packaging, I'm not going to start using a clear bottle, because then that means the drug will actually deteriorate, okay? So that is why we are learning this, so that you can actually look at a product, and just by looking, you can actually understand why the manufacturer decided to choose the packaging. Then it must preserve the characteristic properties of the product so that the latter or the product complies with its specifications. It must protect the product against undesirable or adulterating chemical, biological, or physical entities. So you want a scenario whereby the product is protected. You don't have entry of microorganisms, you don't have entry of dust, you don't have entry of any other adulterating particles, okay? Any questions?
On the tropicalized packaging,
yes,
it's only GSK which have done that on the Ambiflox, and then
yes.
or Floxapen, and then the generics we have in the market are not tropicalized. Does it mean that there is something the guys who are making generics have done to improve on what the innovator did, or what does that mean?
Actually, when you look at, that's a good question. And when you look at the generics, we said it's the active ingredient. It's the same as the innovator drug, okay? So if anything, you need the generic to be handled in the exact same way as the original drug to assure quality, okay? And that reminds me, a few years back, one of the pharmacists within the local industries was actually telling us that they tested their generic product, okay, and compared it to Ampiclox on the market. And what they found was that the Ampiclox, their generic product, okay, by the end of shelf life, it was actually failing the test. But the Ampiclox, it went on even beyond the stated shelf life. And what they realized was the difference between their product and the Ampiclox was actually that tropicalized packaging. Because if you look at these medicines, they are sensitive to moisture. Think about augmenting the active ingredient in when you use it in children, you actually have to give it as a powder. And immediately you reconstitute it. What are you told? You're told you can only use it within 5 to 7 days, depending on whether you keep it on the fridge or on the shelf. Beyond 7 days, the active ingredient in that drug, okay? The same thing with Ampiclox for children, okay? Or Fluclox. These drugs usually will, once you add water to it, the drug just deteriorates. It loses activity very fast, okay? So you can imagine now with a product that is not placed in a tropicalized pack, because in the atmosphere we have moisture. The moisture is seeping in, but not very fast, okay? So that's why this pharmacist was telling us that when they compared their drug, okay, that was packaged in a blister, they realized that by the end of that stated shelf life, the drug was actually below the assay requirements, okay? But when they compared it to the original brand, they actually realized the original brand was able to go even further beyond the expiry. And the only difference, because at the beginning of shelf life, when they compared the two, they were the same. But at the end of shelf life, when they compared the two, their drug had deteriorated so much and the Ampiclox had not, okay? That's when they actually realized the big role that the tropicalized pack actually serves, okay? But remember, we said packaging is not cheap. There's a cost to packaging, okay? Such that if you add the tropicalized pack, the price may even double for your product, okay? Remember, with the original brand, they have no issue with the price, okay? Because remember, they are still relying on that, the originality of the brand. So the cost is not an issue. They can actually give it up, but or rather, they take advantage of that. But these generics are trying to come in to take part of the market of the original brand. So for them, they come in the name that they are cheaper. Okay. Okay. So that is how the tropicalized pack works. Okay. Some of the generics may not want to add it because of the cost going up. But if you carry out the tests in the lab, you actually see significant differences. Okay. Does that answer your question?
Yes, no, I appreciate some of the challenges that we have on the ground. Now, on the other aspect is does the dosage regimen informed packaging, because I've seen in some countries they dispense per blister, but here locally we can't even blisters because our people won't even one tablet the stuff. I've seen some doctors prescribe, and the dosage is either less or less than the package, so a patient has to carry the 2 bottles, or sometimes it's more. So does the treatment regimen or regimen or usage regimens affect, or should it be considered when designing packaging?
Ideally, it could, but you see now the challenge would be if you think about a liquid preparation for children. Think about, say, augmentin that we've been talking about. Usually it will come as 100 ml. And you will find that one child may require, maybe it's an infant, will require 2.5 ml. Okay, so that by the end of the 7 days, they've only used, if you say 2.5 ml, or if they're using 3 ml, maybe twice a day, that's 6 ml. By 7, they've only used half of the drug, 42 ml. Okay, then you have another child who is probably a 1-year-old. You decide this based on the weight, this child will use 5 ml twice a day. That is 10 ml. Okay, by 5. Okay, so again, those are the challenges that the manufacturer would experience. So there are those drugs that it's possible, like you can see even the ones that are packaged in blister. Some of them will be indicated as 28 days. Okay, so some physicians may prescribe in terms of weeks. Other physicians may prescribe in terms of days. Okay, so that to one physician, 1 month is 28 days. To another physician, 1 month is 30 days. Okay, so usually it will be left to the discretion of the pharmacist on how to go about this. Because now at the end of the day, when you're thinking about it, it's the pharmacist, if you give the patient extra drugs, they probably will not know what to do with them. They will just have to and then when it comes to discarding, how do they discard them? Okay, so usually it's left to the pharmacist. Okay, because now it becomes an issue. Sometimes you find some manufacturers will produce it as 28 days. Others will produce it as 30 days. Some doctors will want to treat you for an infection for 5 days. Others will prefer to treat you for 7 days. So this becomes tricky, okay? Packaging now, it's just dependent on the manufacturer, because sometimes you may find they have a machine. That machine is able to run, you know, if they are packing 777, the machine is able to cut every 28 days. The machine will not be able to cut every 30 days, okay? If you're making a package that is a compliance package, such that on the machine you write the days of the week, it's easier to use 28 days, because then you will be using Monday to Sunday, okay? If you put it as 31 or 30, then it becomes an issue, because then the machine will probably not, you will not be able to have a machine that can actually cut it at 30 and still maintain that days of the week, Monday to Sunday, okay? So again, the packaging now becomes the prerogative of the manufacturer, depending on what you're packaging, the kind of equipment that you have, okay? And again, sometimes generally just what is accepted out there. Because you remember, right now we are moving more into blister packs, but initially when medicine was packaged in bulk, it wasn't an issue because then the patient would just get what the doctor has prescribed. If the doctor prescribes 7 days, you give 7 days. If the doctor wants the patient to be on it for 14 days, you give that. But now with the issue, currently what we have is you just follow the prescription, because in the industry, it's not standard. Some industries will do 28, others will do 30, okay? So it's a gray area.
And thank you.
Okay. Any other question? Okay. So if there are no questions, we will stop there for today. We won't be meeting on Wednesday. Okay, that's tomorrow. We won't have a class tomorrow, but we will finish up the rest of the material when we open up the university next year. So have a Merry Christmas and a Happy New Year.